Hello everyone, this is Palak Sharma and welcome to Wellness Diary. Breast cancer is alarming. So here are the tips to avoid breast cancer and to detect it at an early stage. So watch this video till the end and don't forget to subscribe to my channel, hit the like button and drop your views in the comment section below.
Sure. Okay. So as we all know, breast cancer is the most common cancer among women these days, right? So the
Yeah.
awareness surrounding breast cancer is incredibly important because there is insufficient knowledge about breast cancer. So guys, do share this video with your friends and family as raising awareness helps save lives. All right. So today we have with us Dr. Nanda Rajneesh, a general laparoscopic and oncosurgeon with 25 plus years of experience and specialization in breast cancer and colorectal cancer, right?
Yeah.
So she considers her profession a special mission, a devotion. So please join me in welcoming her. So,
Thank you
ma'am,
for that.
yeah, so ma'am, since we all know awareness about breast cancer is really important as better, health seeking behavior, and it is the key to early detection as well, right? So we have some
Okay.
questions. So, what are the causes of breast cancer?
So when you say what causes breast cancer, basically the gene mutation
Okay,
in the breast cells, there are glandular cells in the breast. Breast is, for that, I should tell you, start with anatomy of the breast. So the
okay,
microscopic anatomy is very important. We all know the shape and there are glands and which produce milk during lactation. That's the main function of the breast. But other times, these glandular cells that are there in the breast, they have an epithelial cells which are normal functional and which have continuous hormonal influence on them, and toxins of the body can also accumulate on them. So any gene mutation, when it happens, it becomes a pre-cancer cell first and then cancer cell.
okay,
Okay. So these mutations can happen due to many reasons. It's not single reason the breast cell gets converted
mhm,
into cancer cell. There's no
okay,
one single reason. So we call it multifactorial. Okay.
okay,
15% of the times, yes. 15% of the times, women, 10 to 15, I would say, percent of the times, women do carry a gene mutation within their breast cells. Okay.
okay,
That is, there is a strong family history. Sister is suffering, mother is suffering, and very close relative, father, sisters are suffering. These are all like first degree, second degree relatives, and they're suffering from breast cancer. There is a chance that you're carrying a gene mutation within the breast or within the body round the clock. So then
okay,
what does that mean is that doesn't mean they will all get 100% breast cancer immediately. It may take a lot of time. If the external environmental factors are also very high, then these mutated cells can get become cancerous cells.
okay,
Now, when I said the mutation happens, what are the reasons mutations can happen and why they can develop breast cancer? We call
okay,
them risk factors in breast cancer.
okay,
So there are fixed risk factors which we cannot take away. What are those fixed risk factors? Age. So you get aged, aging itself, that cannot be changed. We all age
yeah,
and we all likely to get breast cancer. Being women itself, we can get breast cancer because we have a larger amount of breast tissue. Men can also get breast cancer, but their
yeah, right,
amount of tissue is very, very less. Amount of
okay,
breast tissue is extremely very, very less. Whereas in women, amount of breast cells and number of breast cells and is very large in quantities, and influence of hormones is also very different and high, especially estrogen influence is very, very high.
okay,
Okay, and ethnicity. Then, Caucasians and Africans, it is very common. So these risk factors cannot be changed. Secondly,
okay,
if they have received radiation, let us say any lymphoma cancer has happened in the chest and they receive radiation, then there is a risk increased. And there is another reason, that is one side women has had a breast cancer, other side they're likely to develop breast cancer.
okay,
So these risk factors cannot be removed. But there are certain risk factors we'll all these are such common factors which can influence breast to get into mutated cells. So these
okay,
risk factors are modifiable risk factors. These are related
okay,
to These are related to our routine lifestyle itself, like
Okay.
vitamin D deficiency.
Okay. Vitamin D.
Vitamin D
D.
deficiency.
Okay. Okay.
Vitamin D deficiency. So vitamin D deficiency, vitamin D is one of the raw material for hormones of the breast itself. So
Okay.
when deficiency is present, there is an imbalance. Vitamin E deficiency, vitamin D deficiency, when
Okay.
because these are raw material for breast hormones, if it is not there, the hormonal influence on the breast is gone. The self-killing capacity of the body, that is, we call it apoptosis, is gone. So because
Okay.
apoptosis, that is self-killing, is gone, then you can develop breast cancer. Second reason
Okay.
is obesity, being fat.
Okay.
Obesity itself causes breast cancer. What are the reasons in obesity breast cancer happens? One is the fat cells are known to produce estrogen-like factors. So
Okay.
estrogen, we know hyperestrogenicity is one of the risk factors of breast cancer. So fat cells in the body being obese, and when they're obese, there is a huge hormonal imbalance, menstrual imbalance. And that is why exercise, weight loss is known to prevent breast cancer.
Okay.
Exercise and weight loss will prevent breast cancer. So
Okay.
then next is nulliparous, being nulliparous. So what happens is round the clock breast cells are going through a cycle of proliferation and differentiation.
Okay.
So when the breast cells are going through proliferation, means increase in number of cells, at
Okay.
that time one abnormal cell is formed. That abnormal cell also increases into proliferation. But
Okay.
during pregnancy, there is more of differentiation. During differentiation, these abnormal cells will get killed. So
Okay.
pregnancy is known to protect breast cancer. So
Okay.
women who are nulliparous who are not having children, they are
Mm-hmm.
likely to have more proliferation and more progression of the tumor. The number of cells which are abnormal can keep increasing due to proliferation because there is increased hyperestrogenic influence. In simple words, if the woman is nulliparous, the estrogen influence is very, very high.
Okay.
If women become pregnant, there is some amount of progesterone influence on the breast, which is good for differentiation and killing the abnormal cells.
Okay.
So,
Okay.
as I said, cancer forms in as a two-hit theory. That is, one hit is that it gets into the abnormal cells, mutated
Mm-hmm.
cell, or the cell which is mutated but it's not active cancer tumor. Promotion, progression into cancer. This initiation first is initiation, then it gets promoted, then into progression. This is how
Depression.
the cells keep moving. So
Okay.
then, what are the other reasons? Smoking.
Okay.
Smoking has got a nicotine which can cause toxic injury to the breast itself. Then is
Okay.
diet, abnormal diet, like diet that contains a lot of chemicals, pesticides, and hormones. Especially
Mm-hmm.
nowadays, milk and some non-vegetarian foods are containing a lot of hormones. Non-veg foods are given that animals are given a lot of hormones to may increase the weight. They can come and influence our breast tissue and our other organs also in the body, especially the breast. When you take milk containing hormones, cows are given hormones
Mm-hmm.
uh, to produce more milk. That hormone comes in the milk and you take it, it comes and
Right.
stimulates your breast.
Right.
So I'm not supposed to produce milk when I'm not pregnant, right?
Right. Right.
So my body is not fully prepared, but there is a stimulation of the breast. So that is why a lot of young girls they're getting some abnormal tumors, fibroadenomas, fibrocystic disease of the breast. Very, very common. If I say there are 10 girls in my neighbor kids, all of them have some issues, and it's better to move
Okay.
towards organic milk, which is very good. Okay, that is
Yeah,
milk,
that's
hormone,
right.
is I think attached everything. Okay, there are
Okay.
certain foods that can cause breast cancer. That
Mm-hmm.
is oxidant diet, we call it. Oxidant diets are a lot of foods that cause gas in the stomach.
Mm-hmm.
Okay? And foods that produce a lot of oxidants in the body and they enter into the circulation. Body tries to do antioxidation, detoxification of these oxidants. In the process, raw material for the hormones is gone. So the
Okay.
hormone imbalance is created due to oxidant diet. So that's
Okay.
why all of us have to eat what is called as antioxidant diet to prevent breast cancer.
Okay, so what are the early
And
signs? What are the early signs of breast cancer?
so if you imagine, we all know two breasts are proportionately same size, but sometimes there can be some difference in the size. We need not worry about
Yes.
that.
Okay.
So if you see any change in the size and shape of the breast, and when you palpate the lump of the breast with the flat of the hand, and you feel a flat lump moving or like felt like a stone, that means lump in the breast itself is a sign of breast cancer. Could be,
Okay.
all lumps are not cancerous. You should remember this. Out of 10 lumps, only one is cancerous. But
Okay.
we need to evaluate all these 10 lumps to see what they are. Okay.
Okay.
It could be cystic lump, it could be fibroadenoma, it could be phylloid tumor, or it
Yeah,
could be
right.
cancer. So
Right.
many types of lump.
So,
Lump. Then discharge from the nipple, especially
okay.
bloody discharge, is a sign of blood discharge
Okay.
is a sign of breast cancer. And any erosion or ulceration around the nipple, we call it Paget's type of breast cancer. Paget's disease, we call
Okay.
it.
Okay.
And retraction of the nipple, because see, the glands and the ducts, they are in a particular proportionate manner. When the tumor starts growing, it pulls the nipple backward. Retraction of the nipple is
Okay.
one of the signs of cancer. And retraction or dimpling of the skin is moving backward at the
Okay.
site of tumor. So
Okay.
that these are the signs of breast cancer. And there's one more sign called pedo orange, redness of the breast,
Mm-hmm.
and like an orange, dimpling of all over the
Okay.
breast. The little
Okay.
advanced stages of breast cancer, we see these as,
Okay.
and there are inflammatory carcinoma of breast can present in a very short time. It can grow very fast also. So it
Okay.
can show in very short time tumors. Okay. Now, the once you see any of these signs, do not wait. Please go to the doctor. They can really
Right.
help you to diagnose and take forward for the treatment.
Yeah, exactly. I agree. So sometimes we get these lumps or some cysts in armpits, right? So that's also a sign of breast cancer, or
In
what
the
is that?
armpit, yes. Yes, if it is associated with the lump in the breast and you feel a lump in the armpit, yes, they are breast cancers. But
Okay.
you know what? By hereditary, lot of people are developing lumps in the arms. They are called axillary breast.
Okay.
So they need not be cancers. And
Okay.
especially when you're feeding mother, when you're feeding, they can become very big also. So it's an
Mm-hmm.
excessive breast tissue in the axilla, that's all. Their tumor can come in the axilla itself primarily, but otherwise, if you see a large lump in the axilla, then you should always examine your breast to see if there's any
Okay.
other lump in the breast. And maybe you
Okay.
should go to the doctor. It could be a spread
Okay.
of the tumor, because from the tumor in the breast, it straight away goes to axilla first.
Okay.
Okay, the local spread of the tumor is to the axilla. So sometimes breast cancers can manifest as headache because it is spread of the cancer to the brain.
Okay.
It can manifest as lung, chest, cough. It can manifest as large liver lumps.
Okay.
So we are doing investigations for something else in the ultrasound abdomen. We see the lumps there. So it could be a metastatic tumor. So these are little advanced stages nowadays. Because of so much awareness, like thanks to you that you are bringing so much awareness, and it's really good what you're doing.
Thank you.
Uh, like this, there is a lot of awareness among women. So we are finding cancers at a very, very early stage. Like if you go back to my practice in 2001, 2004, 5,
Yeah.
I would see only stage 3 or stage 4 cancers. Just
Okay.
remove, knock off the breast and give them chemotherapy and radiotherapy. It was a
Okay.
straightforward treatment. But now, what I see is small tumors, because they go for a health checkup.
Mm-hmm.
Every day from the health checkup, at least 4 or 5 patients are coming
Okay.
with some lump. Okay.
Okay.
So we try to diagnose them. Out of
Mm-hmm.
10, only one will be cancerous. But the
Oh,
thing is, I am picking up that cancer at such an early stage. I just remove it with some ultrasound guided marking we do. We put a
that's
wiring,
nice.
then through that wire, because it's too small, very difficult for
Mm-hmm.
me to access the eyes.
Mm-hmm.
So we have image guided removal of excision. We remove it, and then we know that patient may not need chemotherapy at all.
Okay.
Radiotherapy they need because we are conserving the breast. So there should
Okay.
not be tumors part of the breast. But normally, when you detect early, women do not lose their breast. Shape will be perfect, like normal, as though some
Okay.
small injury happened. That also we can avoid by taking a periolar incisions that cut around the areola. So we breast surgeons are normally not just breast surgeons. We are also oncoplastic surgeons. Means like we do a plastic surgery on the breast and we remove the lumps. And women do not. That is the reason. This awareness is very important. If
Right.
you're aware, checking yourself, and you do scans, and then you pick up
Yeah.
at an early,
Yeah.
and
So
then
huh. Yes, yes,
yeah.
ma'am.
So then what happens? You don't lose breast. You may not need chemotherapy because a lot
Right.
of times fear chemotherapy itself. So
Mm-hmm. So what are the basic checks that we should do, more often, and how often should we do that?
yeah, when you ask me investigations, what we do, what should do? So we have to do what is called a screening for the breast. So I and
Okay.
you are normal persons, and we have to do breast screening. Before 40, you don't do mammography unless doctor is wanting it.
Okay.
Please for this. Okay.
Okay.
I would advise before 50 also you don't do mammography unless doctor advises it.
Okay.
But if there is a family history, I advise mammography at 40 also. That is
All
40
right.
and every 3 years you do mammography. But otherwise, all of us from the age of 20, we
Mm-hmm.
have to do ultrasound breast every year. And
Okay.
every month we have to do self breast examination. And every year one doctor's visit.
Okay.
Let us see if you're doing health checkup every year. Health checkup will have a package for ultrasound breast,
Mm-hmm.
and you will have one visit to a doctor, some physician. At least she'll go through the ultrasound report, and if there is any suspicion or dense breast or any intracellular calcification or cyst in the breast, fibroadenomas, any adenomas or lump in the breast, she will refer you to the physician, so the breast surgeon
Okay.
or a breast specialist, specialist, oncologist. So, what you should do is more important is self breast examination.
Yeah. Right.
Self breast examination is every month you examine your breast in two positions. One is lying down position and sitting position. So, which
Okay.
day you would do is more important. Either you do 5 days before your periods or 5 days after your periods. Fix
Okay.
one particular day. Fix one particular day, whichever you want, even mid cycle or one particular date you want to do, you do it. One is stand in front of the mirror and look for the position of the nipple, size and shape of the breast, and also roll your hand up and down and side to see
Okay.
any lumps.
Okay.
Similarly, lie down also, roll your hand up and down, roll your hand side and see if there are any lumps. And look for whatever nipple retraction, retracted skin, pedo orange, anything is there, you have to look for it
Mm-hmm.
in the mirror. Find something,
Okay.
immediately go. Find something, go to doctor immediately. See, recently I have had very young girls, like 34-year-old one girl. She was doing only night work, BPO, they call it.
Mm-hmm. Right.
They work in the
BPO, I
night.
know. Yeah.
Yeah, they worked in the night,
Mm-hmm.
and a lot of hard work, stress, bad food,
Okay.
all these things
Bad
together. Like
lifestyle.
mastitis, infection of the breast can cause also breast cancer.
Mm.
She had mastitis a few months before. Following that, suddenly she came with a lump, small tiny lump,
Okay.
very tiny lump, and turned out to be breast cancer. And she didn't have to do chemotherapy. Her breast shape
Okay.
was perfect. And
Okay.
so this awareness is very important.
Yeah, that's right.
Lump at an early stage. So uh, it can come as young as even 19-year-old is my one of my patient. Her mother was suffering from breast cancer, and she had breast cancer at the age of 19.
Okay.
Now today she's 27 and she's a pilot in Australia. So nothing goes away. I mean, her lump was picked up at the age of 6 millimeters. Sorry, at the size where the size was 6 millimeters, because her mom was a doctor and she is also a breast cancer patient. She wanted her daughter to
Okay.
do just an ultrasound, and they picked up tiny lesion which
Okay.
was calcified. We removed and it turned out to be cancer. Now, because she has a gene positive, also BRCA gene positive, she removed both the breast
Okay.
and she did the reconstruction of both the breast, because we know Angelina Jolie's story. It's a very big thing. If there's a
Mm-hmm.
family,
Right. Yeah.
your breast. mastectomy. Subcutaneous mastectomy you do and you put the implant. But I do not suggest to all the Indian patients because I don't think we can adapt to such things.
Yeah.
If there is a family history, what you should do is do a doctor visit once in 6 months, compulsory. Self breast examination, be very rigid with that. And get the BRCA gene test if possible. If gene is positive, you have to be even more aggressive with the follow up. If gene is negative, it doesn't mean you won't get cancer. And follow a good lifestyle, which I would suggest for everybody.
Okay.
Okay.
Yeah, that's really important.
We'll talk about that. Yeah.
Yeah. So, when you say that, yeah, we have breast cancer in our family history, so we should actually, it should be our priority, the self-examination and the test as well. So, how often should we go for mammograms in that
No,
particular
you
case?
for 40, I don't suggest mammography. If
Okay.
needed, doctor will advise you MRI mammography. Don't do radiation
Okay.
mammography. After 40,
Okay.
start doing radiation mammography. Before
Okay.
40, do MRI. And if you can afford, nothing like it, but you do MRI mammography and not the mammography, if you can afford. Okay.
Okay.
So, and then every 6 months, do an ultrasound of the breast. If there's a strong family
Okay.
history, do ultrasound of the breast every 6 months. These days, what happens? Bangalore, because Bangalore is a bit of corporate world. A lot of young girls working in companies. Suddenly, they come to know their mother is suffering from breast cancer back home, so they really fear about them getting themselves. So they come to visit, and examination is good. But you know what? If they follow a good lifestyle, yoga, exercise, meditation, not
Exactly.
putting on vitamin D correction, vitamin E correction, good antioxidant diet, all these will prevent promotion and progression. There may be initiation of the mutated cells,
Yeah.
the mutated cells in the breast, but it may not promote and progress into cancer.
So I think the session is really helpful. And so, guys, these are the preventive measures that we can focus on, a good lifestyle and the diet. Diet should be really good, work on your deficiencies. As ma'am mentioned, vitamin D deficiency, vitamin E deficiency. So work on your deficiencies, overall vitamins and minerals. And also the self checks, self examinations, the awareness is important. So I hope ये session आपके लिए बहुत helpful रहा होगा. And guys, do share this video with your friends and family. Okay, क्योंकि ये आप जितना share करेंगे उतना लोगों को help करेगा. So, and thank you so much, ma'am, for this
Thank you.
really, incredibly helpful session.
Thank you.
So thank
Thank
you
you
for
for
that.